of the desired results from any surgery is freedom from injury, freedom from infections. Human skin, which is the best defense against infections, is also and can also be a portal and transmitter of infections. The human body contains 10 raised to 13 human cells and 10 raised to 14 resident bacteria. If a breach in skin is made, there is a route for the bacteria to enter the body and potentially create an infection. According to the CDC, bacterial wound contamination is a necessary precursor to infection. What do you know about skin preparation? Infections following surgery, that is, surgical site infections, SSIs, are a major public health problem throughout the world, with 67% caused by SSIs and 33% by other causes. On an average, patients who develop an SSI will remain in the hospital for an additional week, resulting in additional healthcare costs per affected patient. Patients who develop SSIs are also 60% more likely to be admitted to the ICU and are twice as likely to die when compared to patients who do not develop SSIs following surgery. The goal of pre-operative skin preparation is to reduce the risk of post-operative wound infection. This is accomplished by removing soil and transient microorganism from the skin and reducing the resident microbial count to subpathogenic amounts. Risk is further reduced by using agents like Walkatine, which inhibit rapid rebound growth of microbes. Choice of prep agents and prep technique is important. 60% of the surgical skin preps used is iodopovidone. Let's look into the steps that can be taken to decrease SSIs. Walkatine scrub should be used for scrubbing the hands of surgeons prior to entering the OT. Surgical site to be scrubbed and painted by Walkatine scrub and solution respectively. Dressing of the wound with Walkatine ointment and use of Walkatine powder on open and oozing wounds. Checklist before surgery. Couple of hours before the surgery, patient's hair is trimmed as close to the skin as possible. If trimmer is not available, we can shave the skin. Remove all nail polish and trim all nails. On the day of the surgery, patient is told to have a bath with skin cleanser solution. Ask if he has any known allergies. A surgical preparation tray should be kept on different preparation table, which would have Walkatine scrub, Walkatine solutions, sponges, small basin for solutions and sterile towels. Scrubbing of hands before entering operation theatre for surgery. It has been found that the hands of medical personnel can have bacterial counts in the range of 3.9 into 10 raised to 4 to 4.6 into 10 raised to 6. These flora are divided into two subsets, resident and transient flora. The goal of a surgical hand scrub is to eliminate transient flora and reduce resident flora while inhibiting growth of bacteria under gloved hands. Remove all jewelries, rings, watches, bracelets. Wet hands, forearm and arm 3 inch above the elbow with water. Pour 5 ml, 1 teaspoonful of 7.5% of Walkatine scrub on the palm of the hand and spread over both hands. Without adding more water, scrub thoroughly for about 5 minutes. Scrub in between the fingers, paying attention to palms, fingernails and thumb. Add a little water and develop copious suds. Rinse hands, forearms and arms by passing them through the water in one direction only, from fingertips to elbow. Do not move the arm back and forth through the water. This prevents bacteria-laden soap and water from contaminating the hand. Repeat the entire procedure using another 5 ml of scrub. After scrubbing the hands, proceed to the operating room suite, holding hands above elbows. Once in the operating room suite, hands and arms should be dried using a sterile towel and aseptic technique. Ask the assistant to help you wear sterile surgical gowns, caps and masks. Then wear your sterile gloves. Expose the skin area to be cleaned by folding back the sheet. Double check the operative site and procedure against the patient's chart and operative permit. Place sterile towels above and below the operative area to isolate the area and protect gloved hands while performing the prep. Patient's pre-operative skin preparation. After the patient is anesthetized and positioned on the operating room table, the pre-operative skin prep is done. Scrubbing and painting the surgical site. Using dry, disinfected forceps and new cotton or gauze squares soaked in 7.5% Vocodine scrub. Thoroughly cleanse the skin. Using the wet sponge, scrub the skin starting at the site of incision with a circular motion in an ever-widening circle to the outer portion of the exposed area. You must use sufficient pressure and friction to remove dirt and microorganisms from skin and pores. After reaching the perimeter, a new gauze square should be selected and the process repeated. This should continue for approximately 5 minutes. Discard the sponge after reaching the outer edge. Never bring a soiled sponge back towards the center of the area. Repeat the scrubbing using Vocodine scrub with a separate sponge for each round. Scrub for a minimum of 5 minutes. Rinse off Vocodine scrub using sterile gauze saturated with spirit. Paint the surgical area with 5% Vocodine solution. Work from the operative site outward for several centimeters. After reaching the perimeter, a new gauze square should be selected and the process repeated and allow it to dry. This step completes the pre-operative skin prep. The soiled sponges are discarded into the kick bucket. All unused sponges and those used and discarded into the kick bucket must be removed before the case, that is, surgical procedure begins. Post-surgical wound closure. After the sutures, clean the surgical wound with gauze soaked in spirit to remove all traces of blood and tissue. Clean the wound edges well. Apply the Vocodine ointment and give a dressing appropriate to the wound or site. Vocodine ointment comes with nozzle applicator, which ensures hygienic application. After sutures, a thin layer of Vocodine ointment on the dressing right after surgery and at dressing changes reduces the risk of wound infection. Sometimes a layer of gauze soaked with 1:10 dilution of Vocodine solution is also used. Similarly, in open or oozing wounds, Vocodine powder is used and it has to be sprinkled generously 2 to 3 times in a day. Characteristics of surgical scrub Povidone iodine. Performance characteristics for a surgical scrub agent generally fall into following categories. Antimicrobial action. An ideal agent would have a broad spectrum of antimicrobial activity against pathogenic organisms. This agent would have to work rapidly. An agent that does not work rapidly may not provide adequate bacterial reduction before being rinsed off. Persistent activity. An agent offering persistent activity keeps the bacterial count low under the gloves. It is not unusual for a surgery to last in excess of 2 hours. Studies have shown the rate of glove failures, non-visible holes, increases with the duration of surgery. In addition, studies show bacteria grow faster under gloved rather than ungloved hands. Safety. The ideal agent would be non-irritating and non-sensitizing. It must have no appreciable ocular or ototoxicity. Be safe for use on the body and not be damaging to the skin or environment. Walkatine. Fast-acting, persistent, cumulative in its activity, and non-irritating. Walkatine has excellent coverage against gram-positive, gram-negative, mycobacterium, virus, fungi, and spores. It is recommended to be used for surgical skin preparation. Walkatine 5% is recommended for short-duration surgeries, burns, traumatic, lacerations, etc. Walkatine 10% is recommended for preparing the surgical site for long-duration, complicated, and traumatic surgeries. Walkatine ointment is recommended for wound closure, also in furunculosis, boils, secondary infections in burns, etc. Walkatine powder is recommended for episiotomy, exudative, and surgical wounds. For effective prevention of surgical site wounds, Walkatine provides effective solution for scrubbing, cleaning, painting, and dressing needs of each surgical procedure and protocol. This education initiative is brought to you by Wockhardt Limited, makers of Walkatine.